reporter coming to you live from Midwestern USA. Today I'll be interviewing a young college graduate who will tell us about his experience in trying to get health care for himself. Hi Tom, tell us about yourself.
Hi Kitty, I graduated college just recently with honors and have been working. And I'm a soccer player. I also ski. I consider that I'm pretty athletic and in great shape.
You look like you're in great shape. So tell us about your experience with the insurance company. I heard you just applied for insurance.
Well, I applied to this insurance company called Keep Out Permanente Insurance and just got a letter saying that I have a pre-existing condition. Their byline is, we don't insure if you ever went to a doctor for anything in your life before you came to us, or only apply if you have never been sick one day of your life before you applied to us, or everything you got treated before applying to us is a pre-existing condition.
What? You look pretty healthy to me.
Yeah, I am healthy, but you see, when I was in school, I got some help dealing with stress. And the insurance company said that stress was a pre-existing condition, so they denied me coverage.
You've got to be kidding.
No, actually, I did some research. I found out that many people who work for this insurance company get bonuses for not insuring people. I think they use this as an excuse not to insure me.
What can you do about it?
Well, I've heard that some states are passing legislation to stop this type of abuse and fraud. I think it's a disgrace. Basically, they're saying, if you have a problem, don't go to your doctor for help if you're in school. I mean, this is a bad message to send to a lot of young people in college. I mean, what's their alternative, right? So an insurance company is going to penalize you because you get help during a specific time in your life? I think it's pretty disgusting.
Yeah, it sounds really ridiculous. I mean, let's see if we can have some information from Betty Bunny. She's been doing some research in the field to find out if this is happening for other students as well. Betty? Hi, Kitty. Hi, Tom. So glad to be here today. It's a really tough situation that's going on right now because the Congress and Senate are trying to pass health care reform. And they do have a clause in there to deal with pre-existing conditions, but right now we're not quite sure when that will kick in. It seems to me that until it does kick in, it sounds like from your experience, the insurance companies are really using this time to abuse the system. We've got to do something about this. And I think that there are states like Massachusetts who are trying to stop this kind of abuse. But really what needs to happen is you should probably contact your senators in your state, both federal and state, and say, what kind of legislation can protect people like me? Seems that a lot of other students are going through this. It could also be an excuse for them if you come back to them and you say, well, I don't have a pre-existing condition. Then they'll say, well, we'll only insure you if you pay gazillion dollars. So, some people are using it as an excuse to then charge you higher rates so that they know that you need insurance. The other issue that we have here is that once you're labeled as having a pre-existing condition, with electronic information, what does that do to you? Are you marked for the rest of your life? Does this cause you to always have a situation where you're going to have to pay higher rates from any insurance company that you go to? This is clearly not acceptable, especially for young people who are much more healthy than their older counterparts. It seems as if the insurance companies want you to be healthy until it's time for you to go on Medicare. This is unacceptable. Back to you, Kitty. Thanks, Betty. What a great report. Thank you, Tom, for coming. Stay tuned for more Hot Cats Meow topics with Kitty Reporter. Bye-bye for now. Have a happy tomorrow.